today what we're going to be going over is the first step in our unilateral quad dominant training movement pattern, okay? And that's going to start with a split squat exercise. So with that, what we're going to do is we're going to cue our clients to take one step forward, one step backward, and I really want to focus on dropping that back knee straight down towards the floor to get a nice double knee bend. What we're looking for from a lateral view is having that nice stance, so when I drop my back knee straight towards that floor, I'm not going to touch the floor, but I'm in a nice 90-degree bend here, 90-degree bend here, making sure that knee isn't tracking forward. If that knee does track forward, it might be more of a movement pattern issue where they are just leaning and lunging forward, or it might be a mobility issue in that lower calf where that heel picks up, and that's what's driving the knee forward. Looking at it from a straight on view, what we want to make sure is that we're not swaying side to side, the hips aren't shifting, and we're moving straight down. The knee tracks right in line with the midfoot, if anything, slightly towards the pinky toe, not tracking inward at all. Okay, moving upstream, we want a nice, tall, proud chest. So what we want to see again from that lateral view, nice positional stance here, straight down, maybe a slight 5 to 10 degree forward lean, so we're not extending at that lumbar spine, but we're not getting pulled forward here. A couple issues might be, again, just that movement pattern issue. They're used to leaning forward, so we just need to cue them out of coming down and leaning forward. Or it could be due to tight hip flexors, weak abdomen, which we would reference our mobility and strengthening exercises to help fix those issues, okay? Primary muscle movers here, we are working our quads and our glutes and our lead leg to control that eccentric portion of the movement, and then using our glutes and hamstrings to push us up in the concentric portion and really focusing on that great stretch of the hip flexor a little bit through the quad. After that, once they pass that body weight version, we're going to go into loading it in a goblet position. Okay? Throughout this entire movement pattern, one thing to keep in mind is that our primary movers always stay the same, but depending on how we load the exercise is going to be dependent upon what tertiary muscle groups that we are working. So here in that goblet position, my movement pattern should stay the same. Straight down, straight up, from the side, straight down, straight up, and you should not track forward. But now in addition to those primary muscles, I am also engaging through my shoulders, my biceps, and then that anterior core because I'm changing my center of mass. Okay? So from there, the next way that we will load this exercise is staying in line with our center of mass, weight at our side. All we're doing here is adding more of a challenge, more resistance to our primary and secondary muscle group. No additional challenge to the core, but we are adding a little bit into that upper and mid back, just having to hold the weight, maintain great posture. Okay? From here, we go ahead and we load this in a front rack position. This is going to be exactly like that goblet squat. It is just easier for the client to be able to load slightly heavier weight, but as we do that split squat movement again, we are challenging that anterior core, preventing flexion or extension, and flexion of that upper torso, as well as challenging the shoulders and the biceps. From there, we can work on some unilateral loading of this unilateral movement. Okay? We will always start weight at our side of the foot that is forward. Okay? Weight on the side here, we're going to be working that opposite oblique and abdomen, as that is going to prevent us from leaning over towards that weight. Again, we put it towards that planted foot because that's where we're going to be strongest. We also add a bit of a lateral or frontal plane component where we are strengthening a little bit more of those abductors and external rotators. So we're getting a little bit more of that outside of our glute involved with this exercise. From there, we will go ahead and switch sides to where we're now loading that opposite of our planted leg. Again, I am just changing the tertiary muscle groups, challenging my opposite oblique, but making it a little bit more challenging because I'm staying away from this planted leg. And then the last way we'll load this is in that front rack position, focusing on the same things, front leg first, lead leg first, but it's now a combination of that front rack and unilaterally loaded, where it is an anterior core movement along with my obliques as I move up and down throughout the movement pattern. So key things to look for there throughout is sticking with those foundational movements of straight down, straight up, great tall posture so that we know, and if we're not seeing that, we know to address the hip flexor or the abdomen, making sure that knee doesn't track in, stays out over the toe. And then we're not coming onto that ball of our foot. Heel stays planted, driving through the heel. In the rare occasion that we don't have someone who can perform this exercise, what we can do is add an assist where we have them hold on to this TRX right at the chest, and then they move into that split squat position, and they can use their arms as little or as much as they need. What we want to focus on in Q is that client to maintain great spinal posture so they're not leaning back as they use the TRX, and then try to use this more on the way up. So they're pulling themselves up, but learning how to eccentrically load that pattern where they're stronger, and then give them where they need.